So today it gives me great pleasure. We have two amazing women that are joining us, and we have the opportunity to be able to ask them some questions about their experience of breastfeeding in terms of pregnancy. So I'm going to start first of all with just a short introduction. We have with us today Lucy, who is from Kenya. She is the team leader for Positive Young Women's Organization. And Lucy has a 5-year-old that she breastfed. So we're going to ask her some questions about her experience of breastfeeding. We also have with us today Cece, who is from the United States. And she is a program coordinator for the Well Project, as well as the owner of Healing is Voluntary. Cece is herself 4 months pregnant, so she is really at the stage where she has some decisions that she needs to make. Okay, Lucy, so I'm going to start with you. I'm going to ask you a couple of questions. Could you perhaps tell us about your experience of breastfeeding, please? How was it raised with you? What did you decide to do? And were you happy with your decision?
Thank you, Michelle. Thank you, Nneka. I'm really happy to be here. So my experience was rather usual. I didn't really have to think so much about it. When I got pregnant, I was told I could easily breastfeed. The issue about formula was not on the table. I think it was because of my demographic. That was not one of the choices that I needed to make. And I was told I could breastfeed for 1 year, and I was told I needed to have my baby on prophylaxis to ensure that there's a prevention of any risk that could occur, and that I needed to be on my medication throughout my pregnancy, because before that I was not on medication. It was before the era of test and treat. So I was only on antibiotics. So I was put on treatment. I think it's called the B+ option here in Kenya. While I was pregnant, and I started, and I was given prophylaxis towards my last trimester to give my baby once I gave birth to her. So it was a very interesting day. She came on a Sunday. So I was not sure, and I didn't think to ask when I was given the prophylaxis if it was the first thing I needed to give her, or I needed to breastfeed her first. So then it clicked, and I asked the nurse, and she was like, "I really don't know, but I think to be safe, or to avoid any risk, you should give her the prophylaxis first." And after that, she did not want to breastfeed. It took her 2 days to get her to breastfeed, because the first thing she tasted was so bitter. And I think it just created a sort of a feeling of, this world must have things that are bitter. I tend to think. And then I breastfed her for 1 year and 2 months. I was supposed to breastfeed her for 1 year according to the guidelines, but I was very sure in the back of my mind I would breastfeed her for 2 years. So when I started now traveling, as my work requires me to travel away from home for probably a week or more, it became quite cumbersome for both of us, because I would come back, I should get funny feeling and bad tummy, because I was not pumping. So I just realized I was doing more harm than any good. So I stopped breastfeeding. Though we are recommended to do 1 year, as I said, I wanted to do 2 years. What I thought in the back of my head, if I was asked, because we are giving them prophylaxis up to 18 months, I would just say I'm not breastfeeding, but I would be breastfeeding. but this is something I would never tell my doctor. So yeah, that's how it all came about. I was happy with my decision to breastfeed, more so because I'm public with my HIV status, so it was not an issue whether I breastfed or not. People already knew. Some had maybe questions to ask, like, is it safe? But they never really asked. But I know it's very difficult for women who are probably not disclosed to their husbands, who do not want the people who are coming into their home to see them breastfeeding, or to see them not breastfeeding. If you choose formula, everyone has this notion, you're either too rich, or you're either HIV positive. So they make the conclusion even before you do. So that this could lead to a lot of pressure. And I know some friends of mine who have to stop breastfeeding once they go back to work after 3 months, because the people they are leaving their child with, they have not disclosed, and you're not sure if they'll give them this prophylaxis, because kids do not like it. It's bitter. It's a struggle. It's the one part that I did not like about the breastfeeding journey. Yeah, so that's my journey so far.
Thank you very much. Just a question to follow on from that. Did you feel that you were given enough information and support with regard to the decision? And then you mentioned a little bit about the fact that, you were open about your HIV status. And so, people might ask questions and that kind of thing. In terms of the questions that may or may not have been asked, did you actually experience any stigma?
I think because of the way I'm out there, I can't say I received any stigma. I didn't have people coming to me and asking very invasive questions. I think I don't know, maybe it's because I'm out there, and maybe it's because people also have information that they did not have before. Or maybe it's because I was also so secluded from the world, would mostly stay at home, and I didn't have to report back to work. So I had to stay. I stayed with my baby for like 8 months at home. I didn't have to leave home, maybe to the clinic. I remember the clinic that I used to take my baby to. There's the 6-month jab that you go for measles when your baby is at risk of HIV that other kids do not go for. So I had to go for that, and I was forced to say why. I was forced to disclose my status. And they were quite supportive. I was like, yeah, people need to be open about such things. It helps us as healthcare providers to provide the best healthcare. And I thought, wow, this is nice. In the facility, I had to switch along the way, because the first facility, they had some, I felt they were playing with my child's health. But this was not because of breastfeeding. It was because they did the first test, the one you do at six weeks, and they misplaced the results. So I just felt these people are not serious, and I'm very anxious waiting for this result. So I switched to another facility. The next facility, it had too many people. It was not as small as the one, so I didn't feel I was receiving as much support. But one thing that I liked about this was that there was a mentor mother. So this is a peer mother who is also living with HIV, who has gone through the journey already, who has breastfed and understands the entire, has experience of the entire process, and they were at our disposal. Though I didn't feel the need to go to them, at least they were at our disposals in the health facility. I just found that really awesome. And for some time, I was a mentor mother myself, but in the community, not affiliated to an organization or anything, so that I'm there for anyone who's going through this journey and needs someone or a shoulder to lean on. So yeah, the support I got was probably the mentor mother aspect. Felt really safe. The doctor were good. There were no invasive questions. I didn't have to feel I'm saying something I don't want to say, or I'm doing something that I don't want to do. Yeah.
Thank you, Lucy.
And thank you very much, Lucy, for that. That was really interesting. And so, Cece, I come to you, and I'm going to ask you similar questions to the questions that Michelle asked Lucy. So can you tell us about your experience of breastfeeding? But first of all, I know that in addition to the fact that you're 4 months pregnant now, you have a 10-year-old, and you didn't breastfeed your 10-year-old. Is that correct? So perhaps you could just tell us about your experiences at that time, and then come to the situation that you're in now, in terms of the discussion that they may or may not have had with you about breastfeeding, and how you came to whatever decision that you've come to, and also whether or not you are happy with the decision that you've made, or indeed whether or not you're kind of flexible still in terms of what you're going to decide to do. Thank you very much.
Okay. Yay, that was so great, Lucy. And thank y'all. So, yes, my first child was born in 2010, and this was 2 years after my diagnosis. So I was still in a space of just really trusting all of the medical providers that were working with me to have all of the answers and to provide me with the best, things that were in my best interest. And so at that time, it was, no breastfeeding. Like breastfeeding didn't even come up into our conversation with childbirth. Like it was just, you should, and it wasn't really said, but it was kind of implied. You should just really be happy that you were able to give birth to an HIV negative child. Now go and give this child this formula, and you'll be fine. He's negative. You'll remain undetectable or whatever it was being called at that moment. Breastfeeding never came up. And it wasn't until a conference back in 2019 that I even really made sense of the benefits for a mom to breastfeed, and to see that there were women out here who were living with HIV who had breastfed, and to see that the recommendations are different depending on the part of the world that we live in. And my mind still can't wrap around that, how someone like Lucy, who lives, and so far away, she had the option to breastfeed, yet I live here. And because we have access to these resources, they say that it's totally not recommended that we breastfeed. So I experienced a lot of postpartum depression after my son was born. I felt like my job, once I gave birth to him, my job was done, because anybody could care for my child at that time. He didn't need me. Like, people could feed him and get that bond, that same bond that I was looking for, that I would have thought I would have experienced with the breastfeeding. Anybody could get that. Now, they're feeding them with the bottle and they're looking each other in the eyes. And it was just like this real psychological thing that really messed with me until this day. But that's my little right-hand man now. Like, we're so close. And I know that a lot of it was psychological, but that really beat me up. Now, with me being pregnant 10 years later, I have become such a stronger advocate for self that I know that I don't have to go with the recommendations necessarily that one provider is giving me. And I have run into that issue already with this pregnancy, where I've been with this provider for maybe about 10 years. And as soon as I brought up my pregnancy, and I was like, yeah, I want to breastfeed. I want to breastfeed because, the Well Project and everything, we have so many cool things going on with this breastfeeding consensus statement, which I'm an expert on, where we sat down and talked to all these doctors and researchers and, urging for more research to be done. And I'm like, yes, I want to breastfeed. And she goes, well, no doctor in America is going to want to work with you with that being like what you want. And that hurt me so bad. And although we've had a pretty good relationship outside of that, I made that decision that day that I could no longer stay with that provider. So and this was within like the first month, I've switched to a new infectious disease doctor. I now have a new OBGYN, a case manager. They're set me up with pediatrics, with a team of people who are willing to support my decision either way that it goes. Because I'm still quite ambivalent. Like, I want to breastfeed, but I might not want to, because looking at people, I pulled my Facebook the other day and was like, how long did y'all breastfeed if you breastfed? And some people were like a month. Some people were like, I didn't do it at all. So even outside of HIV, there's still a decision that the woman, but the choice being there is what is the big thing. I'm not allowing these providers any longer to tell me what I am and am not allowed to do. And often they scare you, because there was a tactic that was also used. Well, if you decide to breastfeed, then, they call social services on you, and, that could potentially get my other child taken away. And that's so scary. But I know women here who are breastfeeding, and that has not been their story. So how is it okay some places and not in others? So being a very strong, open, public advocate this time, because somebody has to pay attention.
Thank you. Thanks very much. And that was very powerful. And I think it is about having access to information that allows you to make a choice that's right for you. but to be supported in that choice, which is, I think, what you're asking for. I wanted to ask you a question about stigma with regard to breastfeeding. Lucy talked about potential stigma that is associated with bottle feeding. If people see a woman who's bottle feeding and they make decisions about her wealth or about whether or not she might be living with HIV. Did you experience any stigma around decisions to or not to breastfeed, or are you aware of any stigma that surrounds the idea of breastfeeding in your situation?
So not particularly, and I feel like that is due to the fact that bottle feeding is so common here. Like, so many women do it, so it wouldn't be like an assumption of something, something's going on with your health. If I did experience any stigma, it was the internal stigma. So trying to unpack at the beginning of a diagnosis that, yes, I am living with HIV now and I am able to have a child. See, I want to cry now. But that meant that something was still wrong with me, because my body was now toxic to this human that I was able to produce. So, trying to talk yourself out of that, yeah, most of it was internal.
Yeah, no, and that's something that I think we don't talk about enough, actually. We focus very much on, the external stigmas that people living with HIV face, but there is a lot, and we're aware of a lot of what goes on inside a person that is just as big, and often actually bigger, I think, than what people are faced with. So thank you very much for sharing that. And we appreciate that very much. So I think Michelle is going to ask the next lot of questions. Thank you.
And I also wanted to thank you, Cece, for raising that issue of internal stigma, because it's really something I see so commonly with women here, where, in being in South Africa, they are encouraged to breastfeed, and there are some women who might actually prefer not to, although it is more of the cultural norm, and so they experience quite a lot of internal stigma, and I don't feel that they necessarily always get the care and attention that needs. Okie doke. So, Lucy, we are back to you. And the final question here is just to really ask you that in terms of healthcare workers like myself, what is there that we can do to help women to make the right decision for them based on what we know about breastfeeding and HIV transmission? How can we support you better in these decisions?
I think for me, what is most important is the information coming from the right people. And the right people in this case are the healthcare providers. When we come to you, we are laying ourselves bare. We know you're second to God. Like, if you told me to jump and something good would happen, I would jump and not ask any questions. So knowing that power you wield and using it for the benefit of not only health, but this person as a person first. Because as women, I think we have for so long bear the burden of thinking of everyone else, and no one thinks of us in this situation. Things like internal stigma and mental health are not discussions that come up or postpartum, because you're not thinking of the woman first. You're thinking of only this child, but there would be no child if there was no woman. And there's need for more support for this woman, and this comes with letting them know what is on the table, laying down everything that is on the table, and letting them feel and have the power of making the choice. I wish I had even that choice of bottle feeding, and at the same time also having the option of breastfeeding, because then you have choices and you don't feel coerced or ready to make this choice. Maybe if I had that option, I've made a very totally different choice than I made then, or that I would make now. So these are important things to ensure that you're giving the woman enough information for her to know that she has choices and for her to make the choice. And once she makes one choice, it's important for one to support them, like what Cece said. The healthcare provider even going to an extent where they're making you feel feel threatened is not an ideal thing. If Cece was not as empowered, she probably would have stopped going to the facility altogether. Like I'm thinking if it was in a setting of here in Kenya, and we find women going to clinics way later into their trimester, the 8th month, the 9th month, because she went during the 4th month, and the way she was received was not supportive. She was being told all the wrong things she's doing, rather than being supported to make a move towards the right choices. So for me, it's more support. It's giving all the options and knowing the power that you wield and using it to the benefit of health, yes, but also to the benefit of the woman. Thank you.
Thank you so much, Lucy. And you raised a really important point there. It's so important that as healthcare professionals, we really need to shift a mentality away from paternalism and really just be there to provide you the choices that you need and all the support you need to carry out those choices. Over to you, Nneka.
Thanks, Michelle, and thanks very much, Lucy. And to you, Cece, what would you say is most important that healthcare providers take away from this? What advice would you give them?
I would say leave all of your personal beliefs and biases outside of that meeting room, because when I come to you, I am a client, I'm a consumer, I'm a person, I'm a woman, and I should be able to, make my own decisions. And even if you don't support it, there are more than just you that are practicing in the field. So if you are aware or not aware, maybe doing a little bit more research. If you don't know the answer, maybe one of your colleagues does. Just because I'm in your office doesn't mean that you have to be the one to serve me through this entire pregnancy. So definitely leaving those biases at home. Like this is my life and I should be able to make the decisions that I choose to make.
Well, thank you very much, Lucy and Cece. This has been really great. It's been wonderful to hear from you and to hear your experiences and to learn from what you've been through. I'd like to thank Michelle for joining me in this really great panel. And I think we will close the session now, and we look forward to your questions. Thank you very much.